Have you ever stopped to wonder how the pharmaceutical industry guarantees that every single pill, every single vial of medicine is not just effective, but perfectly safe? Well, the answer is this incredibly rigorous process called commissioning, qualification, and validation, or CQV. And over the next few minutes, we're going to crack the code on how it all works.
Here's the game plan. We'll start with the basics, what validation is and why it's so critical. Then we'll look at the master plan that keeps it all organized. After that, we'll dive into how you actually prove equipment works with IQ, OQ, and PQ, expand that to entire processes, and then jump into the digital world before we wrap up with why this job is never, ever truly done. All right, so let's kick things off with the most fundamental question of all, the one that sits at the heart of everything in pharmaceutical quality. I mean, really think about that for a second. We're not talking about one batch being pretty good. We're talking about millions upon millions of doses that have to be absolutely perfect, time and time again. So how is that kind of consistency even possible? Well, that's where this core concept of process validation comes in. At its heart, it's just about creating documented, scientific proof. It's the evidence that shows your process does exactly what you say it does every single time without fail. And let's be clear, this isn't just a nice to have. It's a non-negotiable demand from regulators like the FDA.
Now, this brings up a really important point that trips a lot of people up, the difference between verification and validation. See, verification asks, are we building the system right? Does it check all the technical boxes? But validation asks a much bigger, much more important question. Are we building the right system? In other words, does it actually do what the user needs it to do? Getting that distinction correct is absolutely fundamental.
Okay, so we know we have to prove that everything works. But you can imagine, in a huge, complex facility, that brings up a pretty massive logistical problem.
Just picture a modern drug manufacturing site. You've got hundreds, maybe thousands of moving parts, everything from giant bioreactors down to the tiniest sensors. They all have to be validated. So how on earth do you manage all of that without it just turning into total chaos?
The answer is a single incredibly important document, the Validation Master Plan, or VMP. You should think of this less like a simple to-do list and more like the constitution for your entire validation program. For a regulatory inspector, the VMP is the very first thing they want to see, because it proves you have a smart, coherent strategy, not just a bunch of random tests.
So with our master plan, our constitution in hand, we can zoom in from the big picture strategy to the nitty-gritty tactics. It's time to get hands-on and start proving that the hardware is actually ready to go. Let's imagine a brand new, shiny filling machine just got delivered to the factory floor. It looks fantastic, but how do you get from, yep, it's here, to, we are confident this machine can safely make medicine for patients? Where do you even start?
You start with this iconic three-step sequence. It's all about building a case, piece by piece. First up is IQ, or installation qualification. This just proves the equipment is installed correctly. Simple enough. Then you move on to OQ, operational qualification, where you test all its functions, pushing every button, testing every alarm. And only after that can you do the final, ultimate test, PQ, or performance qualification. That's where you prove it works reliably under real-world conditions, using the actual product. And you can't skip a step. Each one is a prerequisite for the next.
So we focused on getting one piece of equipment ready. But, a single machine doesn't make a drug. We need to zoom out again and look at the entire manufacturing journey. So the individual machines are all qualified and ready to play their part. The next big challenge is proving they all work together in harmony. How do you validate the entire chain of events, from the moment raw materials come in the door to the final finished product?
This is where you see a few different strategies. For a long time, the traditional approach was king. You just run 3 successful batches in a row to prove it works. But the industry is really moving towards continuous verification, which uses real-time data to give you constant assurance that everything is working perfectly. And then you've got a hybrid approach, which kind of mixes the two, and is often used when you're making a change to an already validated process. And we absolutely cannot forget about one of the most critical steps in the whole process: cleaning. Seriously, if you're making one drug in a tank today and a totally different drug in that same tank tomorrow, you need absolute documented proof that not a single molecule of the first drug is left behind. That's what cleaning validation is for. It prevents cross-contamination and keeps patients safe.
Okay, let's switch gears and talk about a challenge that's really at the center of all modern manufacturing: the complex and sometimes confusing world of software and computer systems. I mean, think about it.
Today, almost every single step is controlled, monitored, or recorded by a computer. You've got the control system on the factory floor, the lab systems that store quality data. It's everywhere. So how do you apply these validation principles to the digital world?
Well, the entire goal of what we call computer system validation, or CSV, is captured perfectly in this one idea behind the FDA's famous 21 CFR Part 11 regulation. The goal is simply to make electronic data just as trustworthy as a physical paper record. It's about making sure that digital information is just as reliable and legally binding as if it were written down with pen and ink. And you achieve this with 4 key pillars. You need secure audit trails that track every single change made to the data. You need strict access controls so only the right people can do the right things. You need legally binding electronic signatures, and of course, you need robust data security. Put those 4 things together, and you have a validated, trustworthy digital system.
We're getting close to the end here, and it's the perfect time to tackle a really common misconception. A lot of people see validation as this one-time event, a finish line that you cross, and then you're done. But that could not be further from the truth. So after all that work, the design, the qualification, the testing, the validation, is the job finally over? Can you breathe a sigh of relief and walk away?
No way! The modern way to think about validation, especially from the FDA's perspective, is as a continuous life cycle. Stage 1 is designing the process. Stage 2 is qualifying it. That's where our IQ, OQ, and PQ live. But the most important part, the part that never ends, is Stage 3, continued process verification. This is the ongoing routine monitoring that makes sure the process stays in a perfect state of control forever. And that really brings us to the big takeaway here. Thinking of validation as a one-and-done event is the old way. The new way, the right way, is to see it as a commitment, a continuous loop of designing, qualifying, and verifying. So the ultimate question isn't, is it validated? It's, is it staying validated? Is that process in a constant state of control, guaranteeing quality and safety for every single patient, every single day?
Have you ever stopped to wonder how the pharmaceutical industry guarantees that every single pill, every single vial of medicine is not just effective, but perfectly safe? Well, the answer is this incredibly rigorous process called commissioning, qualification, and validation, or CQV. And over the next few minutes, we're going to crack the code on how it all works. Here's the game plan. We'll start with the basics, what validation is and why it's so critical. Then we'll look at the master plan that keeps it all organized. After that, we'll dive into how you actually prove equipment works with IQ, OQ, and PQ, expand that to entire processes, and then jump into the digital world before we wrap up with why this job is never, ever truly done. All right, so let's kick things off with the most fundamental question of all, the one that's